Thank you. It's a pleasure being here. FedEx the last few years has really went to a more of a vertical enterprise of how we're looking at our customers, because our customers do expect innovation from FedEx and a different go-to-market strategy. So the life sciences arena has been extremely robust for us in the growth side of the business for us. If you think about it, 20, 30 years ago, 35 years ago when FedEx started, it was really about the reliability of our services that brought the ethical pharmaceutical, the medical device companies to FedEx because they needed that on-time delivery. There's a patient, that needed something at the end of the delivery cycle. So originally it was just because of our reliability that FedEx was able to grow the life sciences industry. But now we work pretty much exclusively with a lot of our manufacturers that deliver for the ethical pharmaceutical side of things, the Abbott Labs of the world, J&J's of the world, Roche's of the world, and they spend a lot of dollars using our services, but also they spend a lot of time defining where the business is going, what the pharmacies need, what the hospitals need, and how we could provide services in the supply chain, so we try to listen. But what we're going to talk about today is mostly how do we track our packages? How do we have visibility within our supply chain? Who do we give visibility to? First off, our chairman said, in 1978, the information about the package is just as important as the package itself. That's where our investment in technology occurred. So we're changing the game when it comes to tracking. So what are some of those innovations that we came out with? Well, 25 years ago, we had wireless service in our vans, giving real-time tracking to all of our packages. That's an investment. We've invested in giving our customers computers to process their packages. It really was about making us more. We wanted to grow our business, but we had to be more efficient at growing our business to have that tracking and that data for us. So we're a leading edge in innovation and technology, and we use technology to not only improve our service to our customers, but also we provide that data to our customers so they could become more efficient. The efficiencies that we have on a daily basis, if you think about it, we get pregnant and give birth within 24 hours. Every day we wake up in the morning, we have no customers. You vote every day with your packages. So we have to have visibility to where those packages are, and we have to have a system in place that's dynamic to make sure that we could provide that 24-hour delivery that our customers are requiring. Well, that visibility and that technology that we have regarding tracking allows us to do some load planning and allows us to plan our labor and also our aircraft contingency. Let's say Apple is having a huge launch or a huge sale or something like that out of the San Francisco market. We could see the orders that are being processed out of that market. We could see that there's going to be a volume surge out of San Francisco. Well, we have to react to that because not providing service is not an option. So we could take a look at different markets where we have different planes, and based on the availability of other aircraft where volume might be a little bit lower, we could swing in some aircraft into different markets, pick it up, and bring it to our hub for delivery. So that's an area how we use tracking and information to provide that customer experience that absolutely positively has to get there overnight. Now, what do the customers really want to know? They want to know the packages that might not make it. So that's where we've come to say, hey, these few packages might be at risk of making it, so you could call your customer, make some contingency plans, but that visibility, that tool that we're giving is another way for our customer to provide better customer experience for their customers. That's where the world is going when it comes to visibility of tracking. And the same thing when we talk about inbound information. If you're a hospital or a pharmacy, there's tools out there just using our tracking information that we can show you on a web client all of the packages that are coming into you on a daily basis. So we could tell you that we have 300 packages coming to you at 10:30 in the morning, and we have 50 packages coming to you at 3 p.m. In the afternoon. You could plan your labor around that, good, bad, or indifferent. You could do a lot of planning to make yourself more efficient. So, these are how we're using tracking tools to provide value to our customers. No information is not an option. There has to be information, and that is certainly our go-to-market strategy. What our focus is as an organization is we measure absolutely everything because of this data. So we know our on-time performance rate is 99.2%. That's pretty good. But if you're growing at 4%, 5% volume a year, you're dissatisfying still 0.8% of the packages. So what we've decided we're going to do is we're going to measure our failures. So what we do on a daily basis is we have we call it our SQI, Service Quality Index. So it's like a golf game. The more of these failures you have, the worse you are. And what we do on a daily basis say, how come we had overnight RDLs? That's overnight right day lates. We had a package, it was late, but it was late the right day. That's not terrible, right? As long as it's late the right day. The one underneath it, it's late the wrong day. That's very bad. So how do we improve our wrong day lates? What happened that night? What happened that evening? So it's a continual learning experience that we have. This is a last slide, really a little bit on innovation. So I talked about, how we use our tracking and our scanning compliance, to help us manage our business, but also help manage the customer's business. What we've come with is a next generation of tracking. What this is, if you see the red device there, is something that we could put in any package, in any of your packages. What that is the GPS device. So we've got it now where we could put a GPS device in the box. You could track the device on your website to see where it is anywhere throughout the world. Not only that, we're going to tell you what temperature the box is, because in the life sciences, there's a lot of cold chain requirements and temperature requirements. We'll also tell you the vibration that box incurred. We could tell you if the box was open because there's a light sensor in there. So we're continually on the cutting edge of our industry. But the way we view FedEx is we're obviously a service provider, a transportation provider, but we're also a technology company. Thank you very much.
Thank you, Joe. Thanks a lot, Joe, and I appreciate you coming this morning. I appreciate all of you coming out this morning, especially so early. I think it's really refreshing to see what another industry does to solve problems that are very similar within our industry. I think the part where you talked about every day starts over anew sounds very familiar for this, where you don't know necessarily who your patients are going to be, what meds they're going to be on, where they're going to be. Very, very similar issues, and maybe it's, in fact, even comforting that someone else has the same issues and has indeed, solved them so well. So thanks for sharing that. So the next part of our program is really how do we apply some of these principles, in our industry. And so it's now my pleasure to introduce you to Claude Parnell. Claude is the operations manager of system therapeutics at Geisinger Medical Center, which has been singled out by several organizations, as I'm sure you've heard recently, for their outstanding clinical and cost performance. We're pleased to have Geisinger and Claude as partners. And now Claude will tell you how he and Geisinger have applied these FedEx principles to continue their tradition of performance excellence.
Thank you, Peter. Good morning, everyone. It's a pleasure to be here and talk to you briefly about the positive experiences we've had working with Aethon over a number of years, going back to 2005, and then more recently, in the last couple of months, with chain of custody and medication tracking. I think Joe set the table very well for what I wanted to talk about. He talked about how FedEx uses tracking and the information that tracking technology gives to them to be able to be at the top of their game in terms of being responsive to their customers. And what I'd like to do now is to just sort of refocus your thinking a little bit. Instead of thinking of tracking in terms of packages, think about tracking now in terms of medications and what that can do for us to better serve our customers in a healthcare setting. This is a picture of Geisinger at our Danville campus, and I only show this to kind of illustrate why TUG has been so instrumental in what we've been doing over the last couple of years. Our pharmacy is located in the basement right about here in the hospital. And this is our children's hospital here. And what you don't see in this slide is there's a new 10-story hospital for advanced medicine that's going up here as well. So from where the hospital pharmacy sits to here,